I'm Dr. Huffman from Florida Injury Medical Centers. If you've been injured in an auto accident in the Jupiter area, give me a call. I'm available 24/7 at 866-402-4250. I'm an osteopathic physician, board certified in family medicine, but I've spent over 3 decades in the injury care field. I understand whiplash and soft tissue injuries. I work closely with Jupiter chiropractic physicians, orthopedic surgeons, physical therapists, neurologists to provide local care. Our telemedicine portal is here to help you document your injuries, access medications from the privacy and comfort of your own home. I'm an osteopathic physician, board certified in family medicine, so I communicate with your primary care physician, something most of the Jupiter injury care centers do not do. Your primary care physician will not diagnose or treat injuries, but they want to know how you're progressing, and they want to know there's a doctor there that is monitoring your secondary medical conditions. I also work closely with Jupiter attorneys. They love my reports. I've been doing this for 3 decades. I know how to diagnose and document soft tissue injuries like whiplash. I know how to treat soft tissue injuries. I know how to develop a treatment protocol and how to clearly identify permanent or long-term injuries that may need future care. So in Florida, you have 14 days to report an accident. That's it. On the 15th day, you have access to no care. Despite having paid thousands of dollars to an insurance company, they'll deny access to care. So whether you're at fault or not at fault, both parties need to document their injuries. At-fault parties generally do not document their injuries for fear of rates going up. Well, your rates are going up anyways if you're in an accident. My rates go up every year, and I've never been in an accident. If you document the injury, it doesn't mean you have to go out and get thousands of dollars of imaging or consults. Do nothing. I'll follow up with you in a few weeks. You're doing better? Okay, I'm fine. Let's close that case. However, if 3 or 4 weeks later you have severe pain, you have access now to care. Why would you not allow yourself access to care? You paid all that money to the insurance company. Why give it back to them? They may drop you anyways. They're on the hook for that. You paid the insurance, you deserve care. If you don't need care, don't get care. But if you document your injuries, you can have access to care later. Now, if you go to your primary care physician, they will not document or treat injuries. I do that for them. The other option is to go to ER urgent care, where you sit around for hours among sick people to be exposed to excessive CAT scans, x-rays, sent home with the diagnosis, nothing's wrong, because they found no fractures in the x-rays or the CAT scans. Placed on medication that I could have called in to your home, and up to $5,000 lien. For what reason? That was not the way to go. The simpler way, the 21st century way, is to use telemedicine to report those injuries. After a collision, go home. Call me, 866-402-4250. Free consultation. If you decide, hey Dr. Huffman, I'd like you to go ahead and report my injuries, call in some medications. I send you a simple text link to your phone. You tap that link. We chat. I document your injuries properly, the soft tissue injuries that the ERs and urgent care centers are missing. I get reports off to your primary care physician, off to your attorney, off to the insurance company. I call in medication to the local pharmacy, often delivered to your front door, all without you leaving your home, and better yet, the insurance company pays for it. So why would you go back to the old way of doing things? Once I document the injuries, then we're going to get you into local providers for care. We want to make sure that you have access to local chiropractic physicians, physical therapists, orthopedic surgeons, neurologists. So within blocks of your home, you have access to these providers. I'm there as the primary care physician, documenting properly on the front end so the case doesn't fall apart, treating you medically, making sure you have access to what you need, not what's best for me, what's best for you, so that you have access to early imaging, consults to specialists. That's my role in your injury care. So if you've been injured, you have no matter how minor the injuries, you have to document them, at fault or not at fault. And you can do that through my telemedicine portal, and the insurance companies pay for it. If you've been in care already and you have, you're not happy with the care you're getting, give me a call. I can help refer you into other providers in your neighborhood that will do a better job, maybe more personalized care. Often patients are reluctant to change because their attorney sent them to the clinic. Well, your attorney sent you to a clinic because they want you to get better. They happen to have a relationship with that clinic. They know they do fairly good work, or they wouldn't send you there. But personalities or other issues may come up. Your attorney wants you to get better. So if we send you to another clinic to get better, I'll communicate with your attorney, and they'll be happy that you're in care that you're happy with. That's their goal, is to make sure you get better. So I'm available 24/7, anytime, day or night, 866-402-4250. The call is free. That's my personal cell phone. You're not going to be getting messages from marketing people or nurses or assistants. You're going to be talking to me unless I'm with the patient. So give me a call if you have any questions about this, for a second opinion, a new injury, at fault or not at fault. We make it easy, safe, and comfortable for you to report your injuries, initiate your case. Thank you.